Dog ears in surgery. So, although you certainly can have them with a breast augmentation, it's pretty rare. But let's talk about what they are and how to fix them. So, a dog ear is when we close an incision and there's a little pooch at the end of it, which looks like the ears of a dog. And it usually happens when we're putting together incisions that are not the same size. So, they're not the same length. And this happens in surgeries that we do where we're removing tissue, such as a breast reduction or a tummy tuck. Surgeries where it's just a straight line we open and then close that same straight line, the top and the bottom are the same exact length, and it's pretty rare to have a dog ear. So when you're closing incisions that are different lengths, or you're closing something where a piece of tissue is removed, like a skin cancer excision, it often will have some redundancy or extra tissue on the ends. So during surgery, when we see that this is the case, here's a few of the things that we can do. So when we remove tissue and there's something that's shaped like this that we're closing, and this is kind of like, think of a tummy tuck, but also skin cancer removal. What we try to do to minimize dog ears is to close the edges very nicely, and any redundancy or unevenness we try to have in the middle of the incision, because it typically flattens out really nicely in the middle. But if there's redundancy on the outer edges, you tend to have more problems with irregularity in dog ears. The other thing we do is we don't make the incision too small. When the incision is too small, you're much more likely to have dog ears. So it needs to be the right size. We're always trying to keep incisions as small as possible, but remember, if it's too small, it'll increase the risk of having a dog ear. Now, the next thing we can do in the operating room is do some dissection laterally to elevate the skin and allow things to be a little more mobile so it will sit down more nicely. So that's certainly something your surgeon can do in the operating room. The other option is to remove fatty tissue in the area, and sometimes that will help the dog ear sit down more nicely. So instead of lengthening the incision, we can do those two things so that you have a better contour. It's important to recognize, though, is that dog ears often get better with time. So leaving a minor dog ear after surgery isn't malpractice, like everybody will scream on TikTok. It's probably the best option in a lot of situations because we know as surgeons that most of them flatten out. Now, if you're someone it doesn't, it's a bummer because then it has to be fixed, but a majority of people, when it's small, it will flatten out with time. So say that you're 6 months or more out from surgery and you have a little dog ear. Your incision is not perfectly flat. You have a little fullness, those little dog ears on the side. There's a few different things we can do. So the first thing is if your surgeon examines you and feels as though there's a little extra fatty tissue on the ends, sometimes you can just inject some Kybella or a medication that dissolves fat in the area, and it'll cause those dog ears to sink in. The next thing that you can do is a minor revision in the office. So you don't need to go to the operating room for this. We can just numb up the edges of your incision, extend it out a little further and remove it some extra tissue, and then reclose everything. It's easy to tolerate for pretty much every patient. It's rare that I have someone that can't tolerate a little tiny thing like that in the office. And you can typically go back to your normal activity pretty quickly, and it's a pretty easy fix. Now, if the dog ears are large, it's sometimes hard to do that in the office. Or if you're someone who's just squirrely, having people work on you while you're awake, you can certainly do this in the operating room where we have access to better anesthetic agents for you for some more anesthesia, but we also have access to all of our surgical tools, regular cautery, etc. So when you're filling out your paperwork, most of us use the ASPS standardized consents and we alter them as needed. They will list pages and pages and pages of potential complications, and almost all of them are quite rare that you'll see, and they list absolutely everything. So for breast augmentation, certainly you may see that there, but that would not be a common thing to see with that particular surgery.